evaluating cervical cancer using ultrasound, really important topic, especially, for example, if you don't have cross-sectional imaging, and in countries where perhaps there's not so much screening and the prevalence of cervical cancer is high. So our first speaker, Thierry van den Bosch, I'm hoping he's going to be able to join us in person now, but if he's not going to be able to join us straight after his talk, he will be available later in this session to answer questions. And he's going to talk about evaluating the endometrium with bleeding, but also talking about how to use ultrasound to evaluate women once you have a diagnosis of cancer. So I'm going to hand over to Thierry.
Hello. I will say some words on the ultrasound features of the endometrium in women with postmenopausal bleeding and in women with endometrial cancer. I have no conflicts of interest besides that I'm kind of a ultrasound nerd. In 2010, we published a paper, consensus paper, on how to describe the endometrium using ultrasound, and we can say that before 2010, the main focus of the ultrasound evaluation of the endometrium was the measurement of the endometrial thickness. And indeed, the endometrial thickness is important, and it is so that the thinner the endometrium is, the less likely it is that there is some malignancy inside the endometrium. That was so in 2010, that stands still today. So and the cutoff for the safe cutoff is somewhere between 3 and 5 millimeters. But just measuring the endometrial thickness is not enough. You can see much more using ultrasound. So the qualitative assessment of the endometrium is important. And if you look at the endometrium, you can look at the uniformity of the echogenicity, and the echogenicity might be uniform. Typically in the first part of the cycle, you see a 3-layer pattern, and in the second part of the cycle, you see a hyperechogenic homogeneous pattern, and after menopause, the endometrium is thin and echogeneous in most cases. Sometimes the endometrium might be non-uniform because the echogenicity is disturbed by the presence of cystic areas within the endometrium, or sometimes because the echogenicity of the background endometrium is inhomogeneous. And sometimes you have both the cystic areas and inhomogeneous background, making that the echogenicity is non-uniform. It's important to look at the midline of the endometrium. If the midline is linear, or is it non-linear, irregular, or not defined. This is important, as we will see in a moment. It is also important to look at the junction between the endometrium and the myometrium, and to look if it is irregular or irregular or interrupted, or sometimes you don't see where the endometrium starts or ends. That's important information. And the use of color Doppler is really a part of the routine ultrasound evaluation of the endometrium. And when you switch on the color, you can either see that there is no color inside the endometrium, or there might be color signals inside the endometrium, and you can score the color between 1 and 4, 1 meaning no color and 4 meaning abundant color. But you can see even more details than color or no color. You can look at the vascular pattern of the vessels, and you might have single dominant vessels with or without branching. You may see multiple vessels from focal origin or from multifocal origin. Sometimes you see some scattered vessels, and sometimes you see a circle flow, and that's important because it gives you a hint as to the presence of, for instance, a polyp, cancer, or a fibroid. So that's in 2010, and it's one thing to say that's the way to do it, but it's another thing to prove that it matters. And that's what we did in the first AITA study, looking at about 3,000 patients with abnormal uterine bleeding, and to look at the ultrasound features of the different histological endpoints between cancer patients, polyps or atrophy, and so on. And so we looked at the results, and we looked at the different histological endpoints, and we tried to describe like a facial composite of the different histological endpoints. For instance, atrophy was something we saw quite often in postmenopausal women with abnormal bleeding. The most common pathology we saw with postmenopausal bleeding was the presence of endometrial polyps, and of course, in quite some patients with postmenopausal bleeding, you also find endometrial cancer. So, what are the typical features? Well, for instance, in endometrial atrophy, you expect the endometrium to be thin, and indeed it was so in our study. And if you look at the other features, you see that endometrial atrophy is associated with an undefined midline. It's too thin to have a midline. You don't see the midline. The endometrial myometrial junction is often regular, and if you switch on the color, in the large majority of cases, you will not see any signal, any color signal. So atrophy is associated with a thin endometrium, regular outline, and no color. Okay. In endometrial polyps, you see that the in premenopausal patients, you see the bright edge and a single dominant vessel with or without branching. You also see that in postmenopausal patients, but to a lesser extent. The bright edges is less common in